Liana, I don't know who you think you are, but I definitely can't talk about anal sex in my site. No worries. Not having an STI does not mean people are healthy. Sexual health is not only safe sex practices, it is much, much more. It is our responsibility as Peace Corps volunteers to only approach the topics that will keep us safe and respected in our communities. But don't let that be your excuse when it shouldn't be. If you split your class and work with a counterpart and only one gender and explain some of what was already mentioned in a very scientific manner, then it is no different from working with teens in America. You might have some giggles, but you will definitely give people the knowledge to help them protect themselves. We wanted to make sure you had a list of other sexual health topics we want you to consider talking about and reporting to the Sexual Health Committee about what worked and what didn't and your numbers. So sexual health includes prevention of STI and SIDA, and also STI and SIDA information and treatment information, but it also includes family planning, consent, healthy relationships, puberty and development, clearing up misconceptions, maternal health, both pre- and postnatal, rape, sexual assault, sexual harassment, slut shaming, reproductive rights, sexuality, maybe most easily done in the context of diversity training, virginity, perception of sex, and identifying risky behavior, among other topics. We'd like to encourage you to focus on these topics even in your regular day-to-day work in site. Have conversations about them with your friends, bring them up in English class, and try games that get youth moving. Think SIDA Tag from the Grassroots program. We will be looking for feedback from all of you on what worked and what didn't on each of these topics so we can further compile lists. Till then, let's look at some past activities. Generally speaking, what has worked are special health-related English class in a group of or individual setting, Darshabeb, private instruction, etc., content-based English, discussion groups focused on health during specially marked health awareness periods. For example, December 1st is World AIDS Day, or the month of October being Breast Cancer Awareness Month. Youth Health Club presentations at the Darshabeb or youth camps, youth presentation at local school or association, HIV and AIDS stands at Souk giving out ribbons and information, specifically organized presentations or projects for a community group using members of that group to relay the information, organized group bicycle rides, marathons to raise awareness and to do presentations and do-ars, one-on-one conversations, movie and documentary showing with follow-up discussions, planting symbolic trees for life, skit competitions, projects targeted toward high-risk groups, sometimes focusing on peer education, work with associations on their projects, maternal health groups, Planned Parenthood and prenatal care, teach English fighting HIV, and grassroots soccer. Some of those can be implemented as follows: through a club, English and AIDS reading lessons, red ribbon fundraisers, expressing AIDS through art or theater, such as having your community create a mural or a play, AIDS talks, AIDS fairs, AIDS booths, planting trees for AIDS awareness, house-to-house tea chats, HIV education and empowerment hikes or bikes, community quilts, professional sex worker education, women's empowerment education, and TOTs of HCNs, training of trainers of host country nationals. A lot of information exists on all of these past projects, so feel free to consider asking the Sexual Health Committee for more information on any of them.
Created using Powtoon.